In this series of episodes, we're going to look at evidence-based medicine, combining that with our own professional judgment, optimizing patient outcomes, minimizing risk and harm, and saving the health practitioner time. I'm John Shaske, a clinical pharmacist for over 40 years, and currently I am a clinical instructor at the University of British Columbia. I have won several awards for innovation, both provincially and federally, and an Agent of Change Award from the University of British Columbia. Welcome to Series 1, Episode 1, to optimize outcomes, minimize risks, and save you time. In today's world, people are looking for a lot of information. Unfortunately, like love, they look in the wrong places. So it is the health professional's role to educate the people, optimize the health outcomes, minimize risks, and save yourself time. The objectives for this series is number 1, identify strategies used by myself to achieve higher adherence rates and promote enhanced patient outcomes, looking at smoking cessation as the example. 2, describe a step-by-step approach to reach these healthcare goals, combining evidence-based medicine and meaningful engagement. 3, explain the process of engaging the patients in this process. 4, demonstrate the role of the healthcare professional in the development of a care plan for the patient. And 5, identify ways of quitting smoking. 50 years from now, I want people to look back at me as somebody that was progressive and was looking after their patients. When I look back, I think of some of the procedures that were done, such as sterilization on people that were forced, or the drugs that weren't tested fully and the babies had deformities. And then more recently, with the opioid crisis, when I think about it, the patients did not have the opportunity to talk to the healthcare professionals about the benefit and the risks of pain control. So when I was in my residency at the Vancouver General Hospital in the outpatient department, we were tasked to learn about the compliance rate. That was 29%. And the reason why it was called a compliance rate, because you were to comply to what the care plan was. As the years went by in the 80s and 90s, we would talk to the patients more and explain about drug interactions, side effects, what to monitor for. And things actually got to the point of being 50%, and we called that 50% adherence. However, it's basically flatlined since then. And there had to be a reason, and what I realized was people don't like to be told what to do, and they would prefer to do what they want to do. So by engaging with the patients and finding out what their values are and combining that in a plan, I was able to come up with an adherence rate of 80 and 90%, but it's for what they want and what they feel is important to their health. And by doing that, I feel that it saves me time, saves them time, they're healthier in the long run, and we'll show you examples of that. And we're combining that with the evidence-based medicine and clinical judgment, and we have a complete package. I look forward to talking to you in the next episodes about the patient engagement.